Madam Chair, for letting me join the subcommittee here today for this hearing. It's something that is critically important right now for us as the chairwoman of the full committee, Avery Neese Johnson, mentioned, for all of us as we travel a lot back and forth to DC and to other places. So the safety of air travel is really important. And like Ms. Johnson, I'm also on the Transportation Infrastructure Committee. And so this is something that we have been going back and forth with the FAA on, in terms of the FAA putting requirements on for air travel, which has not really been, FAA has not stepped up in that. Airlines have done some of that voluntarily. But I wanted to ask on the research side here today, I want to ask Ms. Krause, do you believe that FAA and NIH are adequately coordinating on the research problems that we are discussing here today?
At this point, I mean, we've only had some really initial conversations on that topic. I'm aware of informal coordination that's happening, but not a formal coordination that's happening on this topic.
And how do you think that Congress could better facilitate this coordination?
I think asking the question is important, and sort of encouraging that coordination occur. I mean, I think I would that really leveraging all the knowledge that these different agencies have, and it's important in this particular instance to have public health as well as aviation sector coordinating in terms of figuring out the risks associated and sort of what mitigation can occur for aviation travel.
I want to ask all of the panelists, are there ways the federal government can incentivize additional public-private partnerships in research efforts about cabin safety?
I mean, I can start. So I can start with some perspectives. I mean, I think when we have looked at FAA's R&D, they do have a number of mechanisms that they can use and that they do use to coordinate with the private sector on addressing R&D issues. It can also provide them an opportunity to collaboratively work with industry and in the private sector in accelerating needed research. So there are some opportunities there.
Speaking from a researcher point of view, money always talks. And, if there's the money there, the research will be done.
From my experience, especially with the federal agencies, when there are specific calls put out, that usually gets a good response to that. It takes a scientist a long time to prepare a proposal for something that's unsolicited. So I could write a proposal to the NIH or to the NSF, and it would take me hundreds of hours to do that. And based upon my discussions with the CDC, when we were at the end of our Fly Healthy study and trying to kind of drum up more business, they were very unenthusiastic. I could not imagine that we could have gotten similar enthusiasm from NIH or NSF. And therefore, in my own little cost-benefit analysis, I decided it was not going to pay off to submit such a proposal at that time. I might do it again. I might do it differently today.
Thank you. And in the little time I have left, Dr. Hertzberg, on a different kind of different subject here in terms of not in the cabin, but the safety of ground crew. I have Midway Airport in Chicago in my district, and a lot of airport workers are in my district, from bag handlers and maintenance techs. So Dr. Hertzberg, do you have any thoughts on how airport ground crew can best protect themselves, be protected as travelers may be exposed, pass through their workplace? So what can we do for the ground crew in terms of safety?
They should be observing physical distancing. They should be wearing masks. They should be staying well hydrated. They should be constantly washing their hands and keeping their hands away from their face.
Thank you. And I want to thank all of the witnesses for their testimony today, especially Dr. Jones as a fellow mechanical engineer. I especially appreciate your work. But thank you all of our witnesses, and I thank the chairwoman for allowing me to join with the subcommittee today. Thank you.